Hello and welcome. My name is Daisy Malinga. I am a clinical psychologist and I realized I have so much information on mental health, and I realized that there's so much that people don't really know about mental health and mental illness. I will start off with an example. Where do we really believe mental illness? Where do we really know that this is actually a mental illness and this is not an illness? Let me give an example. Say, if you look at people, allow me to use the example of some communities in Kenya. You find somebody in the northeastern part of Kenya walking around with less clothing in their body. If they were doing the same here at the capital city of Kenya, Nairobi, you would definitely think that they're mentally ill. But when you go to the northeastern communities and you find people walking around, maybe let's call it half naked, then that's a normal behavior. So I'm just here to define and to break down what is normal and what is not normal. Basically, as a clinical psychologist or mental health care providers, we usually have something called a DSM, Diagnostic Statistical Manual, that just tells you that this behavior is normal and this is not normal. So it says if we group together some behaviors and we find them meeting a certain criteria, then we would say that this is, say for example, bipolar, or this is depression. But you see, the challenge is most of these manuals were made in the Western world. They're made in the Western world, not capturing what really happens in the African context. They're not capturing religion. They're not capturing things like culture and what really happens in this setting. So is a basic thing I want us to talk about today. This is something that we're going to call the 4 Ds of mental health. So the first D that we're going to talk about is deviance. So deviance just basically means deviating from what is normal, what we're used to seeing, what is the normal setting. Let me give an example. Sometimes you would go to some other parts of Kenya which is really hot, and you'll find that people start off their work actually really early in the morning, and then they break in the middle of the day, and then they continue late at night. If it was in another setting, you'd say, hey Anna, these people must be really lazy. So the first thing is deviance. So we look at what is normal. We look at what is normal in a religious setting. I'll pick out a few religious beliefs. So Muslim, let's say Christian, let's talk about Buddhist. So what these people in the religious setting believe in. So if somebody comes and tells us that, allow me to just from our Muslim brothers, like I usually pray 5 times in a day. So when you're looking at it in another setting, they'd be like, this person has over religiosity. But no, when we look at it, it's really normal for them in their religious setup. So we look at culture. What does culture say about some things? I come from a Western community, and in the Western community, whenever someone passes away, we will bring the dead body and we put the dead body in a coffin in the middle of the sitting room. If somebody from the Western world came, then they would say, these people, there's something wrong with them. According to our culture, it is considered a matter of respect, like we're bringing you back to your house for the final time before you are married, or in your final farewell. So I've just explained on the deviance in relation to culture and in relation to religion. We also look at someone's behavior. There is the way you are wired to behave. Let me give an example of eating. If you normally have a good appetite, there's no way I'm going to start saying, this person is really stressed, because that is normally how you usually are. Most times these behaviors are as a result of how people view you, or how yourself you've just noticed that no, things are different. This is not how I usually am. And that's the most common statement that you hear people say. The next D that we're going to look at is stress. Is this behavior causing suffering to an individual? Feelings of pain or anguish or any other negative feelings in relation to their condition? Most times once you come in for therapy, I will ask you something like, how is your appetite? And then you tell me, I don't usually eat my supper, or maybe I only eat 1 meal a day. For me, I would ask you, is this behavior bothering you? Do you feel like this is a matter of concern? Or let's give an example. If you're more of a plus size person, or if you're more of a slender person, so I would really ask you, is this behavior really bothering you? Like, does your body image really bother you? If it doesn't bother you, it doesn't cause distress, and I don't think it's something alarming. But if you're having a body image of slender, and it's associated with you having negative feelings towards food, having some aversion towards food, like you don't really want food, then it's a matter of concern. The other D that we look at is dysfunction. Every human being has some responsibilities in life. You have a responsibility at your job. You need to contribute to the economy. You need to contribute to the community. You need to do something meaningful to the community too. If you're a student, you have a responsibility to show up to school every day. So if you're a parent and you're watching this, your child has a responsibility to go to school every other day. The other thing, if you're a family person, you have responsibilities in regards to the family setup. That means you need to show up to work. You need to, and for work, there's something that we usually say, I have brought my body to work. It doesn't really mean that I have actively actively come to work. So we are talking about some things like absenteeism, like you're actually missing days of work. And again, remember, we are looking at deviance. You used to be somebody who used to wake up early to go to work. You were basically a hard worker, and then you get to a point where you now retreat, and now you're no longer coming to work every other day. You're showing up to work like 3 times in a week, 3 out of 5 days in a week. So the other 2 days you're not really showing up to work. Or there's something else that we usually talk about that's called presenteeism. Presenteeism means I've just brought my body to work, so I am present at work. So if my boss or if my employer comes to work, they actually see that. But at the end of the day, if somebody asks me, can you account for what you really did? I cannot account. I cannot say this and this and this is what I have done in my day. The other thing is, so my productivity really goes down. My relationship with my workmates is really, really bad. So still really closely with dysfunctioning. I'm not functioning in my social settings. So in my social settings, in my friends, I'm no longer interacting with my friends as I used to. I finish work and I really quickly want to just go home. I'm isolating from other people in my social settings. I used to be an active member of maybe a church or the mosque, or I used to engage in a lot of hobbies. I'm no longer doing them, or I no longer experience that pleasure. I used to like going bowling. I used to like going swimming. And now even if I go and engage in swimming, it's no longer giving me the joy that it used to give me. And that's where we realize that, hey, there's probably a problem here. So when we're also trying to look at some of the children, or even if you're somebody doing your postgraduate studies, when we realize that you're not either completing your schoolwork, or you're not really, your performance is not as good, or you're not actively engaging and finishing assignments, then that's a really big indicator of a problem. Most times, especially this one for school, in Kenya we hear so many students talking about missing marks, or somebody really doesn't show up to class many days. When it's time to do exams, they say, you know what, this is a really simple exam. So they end up stealing the exam. They're caught, and it's now an exam irregularity, and they're told you have to go and bring your parents. But because most of us in an African setting, we're really scared of our parents, so we would basically not even go home to bring our parents. So you might get someone to just come and pose as your parent, or because you're in higher institutions of learning, so that is as per high school. But if you're in higher institutions of learning, normally what you will do is your parents will still send you the school fees, because they trust you old enough, they trust that you're able to do budgets. So they'll send you school fees, and then when they send you school fees, instead of you paying to the school, you take that money and you decide to use it for your own things. And most times it's not even constructive things. Sometimes you'll go out drinking with friends, sometimes you'll just spend the money anyhow, and not really use it for school. And by the time a parent is coming to find out that you're not in school, at that point they're really angry, and they're really thinking it's now a lie on top of the other. So no, you're not functioning in your school setting. So I've talked about school, I've talked about work, I've talked about social settings, and now I'm talking about in a family setup. So most times you're either a parent, you're a mother, you're no longer waking up to prepare your children to go to school, you're no longer dressing them up, you're no longer cooking as you used to, like activities of daily living. Actually, now when I'm looking at activities of daily living, it is considered very normal per se to wake up, to take a shower, to dress up, to look good, to smell good. But you see, most times for some people, whenever they're so stressed out, let me just use the term stressed out, or maybe they're heading towards a mental illness, sometimes they neglect activities of daily living. Say for example, somebody would be like, you used to make your hair really well every day, you used to go and have a nice shave, your clothes were always clean. How come right now your clothes have a certain stain, you have a certain stench, you're no longer brushing your teeth? Then we mean that sometimes you've gotten to the point where you no longer value yourself, you're feeling worthless, you're feeling hopeless, and you really feel like there's no need to show up every single day, there's no need to make an effort. So most times it even reflects in your environment. They're really untidy, they're no longer even making their beds, and remember, they're deviating from what is normal. This is somebody who is to wake up, make their bed, dress up and really look good, and go out there and try and be productive. Now these are things that they're no longer doing. So that is just mentioning a little bit on dysfunction. So I've talked about it in in the essence of a parent. I've even talked about it in the essence of a spouse. And most times we start to experience negative feelings. I usually say it's really normal for anyone to experience feelings like anger. In Kenya or in Africa, we usually have this setting for, I don't think I'm a person who has anger outbursts, or I don't think I'm a person who's angry. No, every single person experiences these negative feelings. Anger, worthlessness, hopelessness, discouraged, frustrated. And these are some of the things that I think in future videos, I'll be able to talk about some of these feelings and how is it that we can really gain some emotional intelligence. So sometimes you're not really functioning. It means people around you, your spouse has noticed that you're really angry, you're really answering with a lot of some outbursts. You're being asked about simple things like where's the socks, and then you're already bursting out and complaining. Maybe it's because of some things that you've always just kept it up and up and up. So that was the third D. So the first one I said was deviance. The second one I talked about was distress. The third one I talked about was dysfunction. And the fourth one I'm going to talk about is danger. So we look at this behavior. Is it posing a risk to an individual or to people around them? So I'll just repeat that. This behavior that we're observing, is it posing a danger or a risk or to themselves? Let me start off with posing a risk to yourself. So how will this behavior pose a risk to yourself? You've heard of this saying where you go to the doctor tells you, if you continue with your drinking, you're going to die. You continue with your drinking, you're going to have a permanent mental illness. You're going to have obesity. You continue with your smoking, your lung cancer or your cancer is going to really, really get worse. But you find this person is persisting with this behavior. I think in future episodes, I'm really going to start talking about why is it that somebody has been told that this behavior is posing a danger to themselves, but they still continue with this behavior regardless of knowing that it's going to cause a risk of harm to themselves or to other people. There's a risk of death. There's a risk of further morbidity. Like you probably become worse. You probably get a kind of addiction. But you're still persisting with this behavior. Drinking and you're driving, posing a risk to yourself that you could get an accident. And despite being warned, you're still persisting with it. You're drinking till late hours of the night. You choose to not take a cab home or to come home early. You see, you're posing a risk or a danger to yourself. So also, a danger to yourself could be through suicide. Okay? So for suicide, most times I'd mentioned with dysfunction and the negative feelings, you're having feelings of hopelessness, you're having feelings of worthlessness. And so you find yourself getting a rope or using various means for trying to take away your life. September is Suicide Awareness Month. In future episodes, I'm also going to talk about suicide and suicide awareness, and just to try and unpack why is it that people would actually choose suicide as a means of ending their suffering, so to say. So sometimes is this behavior causing a risk to yourself? Some people have mentioned in some therapy sessions that they have experienced emotional pain, and they say emotional pain is worse than physical pain. So whenever they experience emotional pain, they would get a knife or a razor or a sharp object and start to make cuttings on their upper arm here, or they start to make some cuttings on their thighs. And most times they say that whenever the knife or the sharp object is going through the skin, they don't feel anything. When they see the blood, that's when they're alarmed. And sometimes it helps them just get rid of it. In some cases, some people would find themselves going to get a tattoo after a tattoo after a tattoo because of the emotional pain. No, I'm not saying that every person who has a tattoo is escaping emotional pain. No, I'm saying that there is that probability, because we have to look at the context. We have to look at all these other 4Ds. Are they ticking out in all these other 4Ds? And are they posing a risk of danger to someone else? So I'm going to look at it in this way. Say, for example, homicide, aggression. So if somebody is walking around with a knife because they want to stab someone, then that is causing a risk to other people around. If someone has a child and is causing harm to the child, say is giving the child drugs or alcohol or something, then it means that they're putting this person at risk of harm. There are people who hear voices that instruct them to do harmful things to themselves and to people around them. Having said this, that concludes the final D for danger. So as I've mentioned about, these are the 4Ds of mental health and mental illness. Remember, mental illness is a continuum. We all exist in a straight line, and in this straight line, there is the end that is normal, and then there's this other end that is abnormal. normal. We experience a lot of events in life, and depending on the events that we experience, we either tip every day towards normal or we tip every day towards abnormal. And nobody is immune to mental illnesses. In regards to the 4Ds that we've talked about, should you get anybody experiencing any one of these problems on, it could happen to you, it could happen to me, it could happen to somebody around you. This is not final diagnosis. If somebody presents with any one of these symptoms that I've mentioned, it's good for them to reach out to a healthcare provider. They could reach out to a clinical psychologist like myself, occupational therapist, a medical social worker. In fact, in future sessions, I'm going to talk about the different roles these people do, sure that we bring health to people's lives. Thank you for allowing me to share this, and I wish you a good day and see you in the next episode. Bye.